In the last weeks of 2015, news of a new mosquito-borne disease began to make headlines in the United States. The Zika virus, transmitted by the Aedes aegypti mosquito, was rapidly spreading in South and Central America, with tragic consequences. But unlike other mosquito-borne diseases, the Zika virus posed unique challenges to public health. The Aedes mosquito that carries the virus likes to breed in tiny containers, as small as a bottle cap. They prefer to live near people and are known as backyard breeders. As travel-related cases started to spread in the U.S., public health officials began to focus their attention on Florida as a likely site for local Zika transmission. On February 3, 2016, Florida Governor Rick Scott declared a state of emergency. Local officials were concerned with preventing the spread of the disease to its most vulnerable population, as well as the potentially devastating impact to tourism. In May, Miami Dade County, with the support of the CDC and state officials, activated an emergency contingency contract with Clarke, a national mosquito control products and service provider. Working with Miami Dade County Mosquito Control and the CDC, Clarke responded to the situation with an intensive program tailored for the site-centric challenges of controlling Aedes mosquitoes.
We went from a handful of crews going out each day to having to put 40-plus crews on the street each day. And as a private contractor, Clarke was able to go out and recruit and then train and get that many people out and in the field, and that was so critical to help stopping this transmission.
Known as Site Guard, this program focused on two-person teams executing door-to-door inspections, applications, and resident education deployed to areas where confirmed cases were reported. This boots-on-the-ground program was integrated with the county's traditional surveillance and control measures, including larviciding and adulticiding. Then on July 29, 2016, the first locally acquired case of Zika virus was identified in the Wynwood neighborhood of Miami, prompting health officials to escalate mosquito control response. The unique biology and behavior of Aedes mosquitoes had prompted the need to innovate. To quickly suppress the Aedes populations, Clarke partnered with Dynamic Aviation and Valent Biosciences to configure a fixed-wing plane capable of making aerial larvicide treatments, which were alternated with adulticide aerial applications. As the concentrated efforts on the Wynwood neighborhood continued, Zika was discovered in Miami Beach, a premier international tourist destination. Clarke immediately expanded the door-to-door site guard protocol, surveillance, ground inspections, and larviciding. However, aerial applications were met with public opposition, which again created a need for application innovation. Clarke engineers quickly adapted powerful buffalo turbine blowers to propel larvicide into backyards and hard-to-reach mosquito breeding sites. The buffalo turbines were used to effectively treat entire neighborhoods, while ground crews focused on applications within an eighth of a mile of reported cases. Throughout the operation, Clarke established and maintained an operation headquarters where crews were trained, equipped, and deployed.
The ramp-up was incredible. We screened, hired, and trained over 161 people in just 42 days. That meant for over 3 months we had 45 two-person crews working 7 days a week. There are a lot of moving parts. Each afternoon we would receive new maps from the county of cases. The next morning at 6:30 we would deploy our team of 45 out into the field to perform door-to-door inspections an eighth of a mile around the confirmed Zika cases.
Crews recorded all inspections and treatments on handheld devices. As they did, supervisors from both Clarke and Miami-Dade could access the real-time information via a live web link and could redirect or redeploy teams as needed. In addition, the Clarke Mobile Response Unit was on site, serving as a mobile lab. By September 19, 2016, the Zika operation in Wynwood was deemed successful, and the CDC lifted its travel advisory for that area. 3 months later, the travel advisory for Miami Beach was lifted as well. In all, approximately 213 Florida residents contracted the disease locally in 2016. While most locally transmitted cases centered in the Miami area, other Florida counties took cues from Miami-Dade and implemented aggressive steps to prevent local outbreaks. Clarke worked with several Florida counties to distribute Z-kits, which included blister packs of small Natular larvicide tablets for homeowners' use in their yards. Over the years, outbreaks of mosquito-borne diseases here and around the world have helped shape and define how we address these public health challenges. With the world becoming increasingly interconnected, we have to expect we'll see more vector-borne diseases. Planning and preparedness have never been more important. While we may not know what we'll face in the future, you can be confident that the mosquito control industry will rise to the challenge.